Good afternoon, dental professionals. My name is Charlotte Gallagher. I'm a board-certified infection preventionist with the Philadelphia Department of Public Health. I have a diverse background as a registered nurse and dental hygienist. I am also certified in dental infection prevention. In an effort to prevent and reduce the risk of dental water-associated infections in dental clinics, I have created this presentation called Get Shocked, Dental Water Safety. After this presentation, you should be able to explain the causes and impacts of dental unit waterline biofilm formation, describe the 4 steps to ensure safe dental water, which are treat, test, maintain, and monitor. And finally, I will outline the requirements for a safe dental water policy that includes training and compliance monitoring. Let's start with a background on dental unit water lines. The physical properties of dental unit water lines contribute to bacteria buildup because they are long, small diameter tubes with slow flow rates. Backflow of microorganisms from blood and saliva can enter the dental water system via the handpiece, air water syringe, and the ultrasonic scaler devices. Stagnation can also occur in these lines when the office is closed and lines are not emptied and left unused. Also, if contaminated inline filters, anti-retraction devices, and turbines are not changed, they can contribute to microbial habitation and growth. So because of these conditions, an insidious bacterial slime layer called biofilm forms inside the plastic tubing, as it will on any plumbing surface. This biofilm slime layer protects the bacteria from disinfectants and feeds the microbes that can then be transmitted to patients through the dental water. The biofilm is insidious because it may or may not smell or be visible. Even in brand new water lines, microbial counts can reach 200,000 colony-forming units, or CFUs, in just 5 days. There are some commonly found infectious pathogens that live and grow happily in the biofilm when undisturbed. These are Legionella pneumophila. This can be transmitted to staff and patients via inhalation of water aerosol and contact with mucous membranes. Then there is Pseudomonas aeruginosa, which is transmitted through water contact with blood or mucus, and it can be drug resistant, making it more difficult to treat. Non-tuberculosis mycobacteria, or NTMs, are also found in biofilm, and they are transmitted via inhalation or contact with contaminated water or dental instruments. They have caused serious infections and even death. And finally, protozoa and fungi cause infection when they are inhaled, ingested, or they come into contact with blood or mucous membranes. To demonstrate the importance of keeping biofilm eliminated in dental unit water lines, I have outlined 2 serious outbreaks that occurred in pediatric dental clinics where the dental water contained high levels of NTM bacteria. Georgia had 24 cases in 2015, and in 2016, California had 71 cases. Children ages 4 through 8 received pulpotomies and became infected with an NTM pathogen called Mycobacterium abscessus. Unfortunately, as can be the case with healthcare-acquired infections of these slow-growing bacteria, the signs and symptoms of the infections were delayed, and serious patient harm, like hearing loss, jawbone loss, and even death, was the outcome for these unfortunate children. Therefore, it should be a goal to prevent infections associated with dental water, so regulations and guidance have been created for staff and patient safety. The Environmental Protection Agency, or EPA, leads public water safety with a rule that municipal drinking water or tap water should all be at a standard of less than 500 colony-forming units, or CFUs, per milliliter of bacteria for dental treatment water. Now, the FDA considers dental unit water line medical devices. The FDA must approve any medical device or patient materials used to deliver dental water and their associated manufacturer's instructions for use, including manufacturer-recommended germicidal products and disinfection processes. In general, the FDA also regulates all chemical germicides or disinfectants used on critical and semi-critical medical devices that may contact any patient tissues. Understand, if a germicide or disinfectant has no risk of contacting a patient or patient materials, the EPA would be the regulator. The CDC pulls it all together. They recommend that all dental unit water lines be treated regularly with FDA-approved germicides to maintain the EPA's minimum standards. Users should consult with the dental unit manufacturer for appropriate methods and equipment to maintain the quality of dental water. Follow the dental unit manufacturer's recommendations for waterline treatment products and monitoring water quality. And when performing surgical procedures, they recommend using sterile saline or sterile water as a coolant or irrigant. Once you understand why we need to combat biofilm and the associated safe water guidelines, you can start to follow steps to providing safe dental water. The first step is a shock treatment to remove biofilms and consequently clean inside the water lines. It's important to know that to keep dental unit water lines free from biofilm, you should first prepare the dental unit water line system by separating it from municipal or city water supply systems or plumbing, because they can contain biofilm that can spread pathogens back into the dental water lines. Secondly, chemicals used to keep bacterial numbers down in municipal water supply may adversely interact with chemicals used to treat and maintain dental water. This separation of lines can be done with a filter at the dental water line starting points, or entirely disconnecting the dental unit water lines from municipal water supply and using a refillable bottle system shown here. But be aware that filling the bottle with municipal water alone after shocking will not prevent biofilm regrowth, because even municipal water at its best still contains bacteria that will reform biofilm. So you should follow manufacturer's instructions on the recommended type of water, water treatment, and preventative maintenance waterline products. Furthermore, you also need to prepare for shocking by gathering proper PPE per the product manufacturer's instructions and safety data sheets. Typically, you'll use heavy-duty gloves, eyewear, and a mask. Now you're ready to get shocked. First, to prevent damage to the lines and devices, adverse chemical reactions, or dilution of the shock product, you will disconnect all devices and drain the lines completely. Then you will mix the products according to the manufacturer's instruction and safety data sheets. Make sure you put on appropriate PPE before mixing and during application. Then you fill every water delivery line with the shock solution for the specified time interval. Immediately place chair out of use signs on the unit to prevent injuries to patients or staff. Finally, empty the shock solution into a bucket or solution. If you put treatment products into suction systems, toxic fumes can be developed when they interact with dental materials like amalgam. Make sure to flush the lines thoroughly to clear all the treatment products and the biofilm. The biofilm appears as a gray slimy sludge. The second step is an initial testing to find out the results of your treatment. There are two types of testing you may choose. In-office testing, which can be done more frequently, has a 48 to 72-hour result time. It may be used to verify compliance, a shock treatment's effectiveness, or provide an early warning of biofilm problems. Alternatively, you may choose a contracted lab service, which has a 1 to 7 day turnaround time. Off-site labs can provide more specific baseline data via auger plate methods. Labs may be used as an external validation to your in-office testing, treatment, or maintenance. Either way, carefully follow the test instructions for aseptic collection, germicide neutralization, and transport of samples to ensure testing accuracy. When preparing for testing, per the test kit IFU, you may need to neutralize any chemicals in water that will interfere with sample growth. Sodium thiosulfate is one type of neutralizer. Again, remove devices, filters, and water dispensers. Wash hands before collecting a sample with aseptic technique. When testing in-house, be sure to use proper sampling media, incubation times, and temperatures. For initial or baseline testing after the first shock, scientific literature suggests that in-office testing results are less reliable than those performed in a qualified water testing laboratory. Follow the test manufacturer or test lab's directions for collection, storage, and transport to testing locations. It is also recommended to perform testing before chemical maintenance program is implemented to ensure effective initial shock treatment. You have achieved a successful result if a less than 500 CFU per milliliter water quality is achieved. You may resume use of the dental unit water lines and retest again in 7 days, then test monthly for 1 year, and then at least quarterly from there on as the water quality is adequately maintained. If the test indicates a failed result of greater than 500 CFUs, all components of the system should be evaluated. It could also be a problem of technique or operator error related to improper dilution or chemical mixing. You must check measures of time or measuring devices. Failing to purge or empty lines fully will cause product dilution by water. The lines may also persist with higher microbial levels if contaminated filters were left on, water bottles were contaminated, or if any lines were not completely exposed to the shock or treatment product. After troubleshooting, reshock and test again until the required water quality is met. After the shock tests are deemed successful, the water quality will then need to be maintained. This is our third step. Physical maintenance requires that all lines be emptied or purged during any vacations, nights, or weekends. Hit the purge buttons at the end of the day or just drain the lines to prevent stagnation. Empty, clean, and disinfect the chair bottle daily per bottle instructions. Then at the start of the day, flush all lines for at least 2 minutes and 20 to 30 seconds between each patient. Also assess lines for damage, musty smell, odor, cloudiness, or particles. Finally, the filters and anti-retraction devices should be replaced per unit instructions. To ensure and minimize contaminant backflow into dental water, use a new disposable or sterilized air water tip for every patient. A chemical maintenance product is required to prevent biofilm and keep levels below the 500 CFU. Remember, just filling the bottle with water alone will not prevent biofilm growth in dental water lines because any bacteria in water will form biofilm. Many bacteria love water, especially when it's warm. The chemical maintenance products of water systems will consist of using low-level germicidal or disinfectants daily in bottle systems. These are only effective once the lines are shocked. Use only fresh distilled, filtered, or commercial drinking water. Be sure to follow all IFUs on all products and devices and keep them readily available for staff. There are 3 types of germicidal products. Tablets can be dropped into water bottles. With the tablet forms, the water should be discarded at the end of the day. Then clean and dry the bottle and refill it on the next patient care day with the tablets added. The straw method slowly releases germicide chemicals, and it can last for months. Be sure to remove these per manufacturer if shocking treatments are used to ensure continued effectiveness. Then there are germicidal cartridges that can be plumbed into a chair supply line to release metered doses of chemical. The cartridge vendor usually installs and manages this product. Once treatment, initial testing, and maintenance have been implemented, our 4th step is monitoring quality. Testing should be completed monthly, and if a less than 500 CFU level is maintained for 1 year, again, testing can be done quarterly or every 3 months. For all testing, document the test date, name of staff testing, specific device line tested, chair and room number, test result, and the product name and lot number. Test every single line, even those out of service that could have contained stagnation. Here's a test log example that includes device checkboxes for simplicity. It is important to monitor and supply suitable water in other conditions as well. Surgical water that may enter a patient's bloodstream or body tissues during treatment should be sterile along with sterile syringes and tubing. Reusable tubing should be sterilized and packaged to maintain sterility, or you may use disposable one-time use sterile tubing. Sterile water or sterile saline should be dated when opened and discarded after 24 hours. Be aware that delivering sterile water from a reservoir bottle attached to dental unit water lines will contaminate the sterile water. Invasive procedures that will require sterile water could be procedures like bone or tissue biopsy, periodontal bone or soft tissue debridement, root canal, implant surgery, and surgical extraction of teeth that requires bone manipulation or tooth resection will require sterile products. Another issue that must be observed would be a boil water advisory. In this case, dental unit water lines dependent on municipal water supply should not be used for any water-dependent dental equipment or treatments. Patients will need to rinse with bottled or distilled water until the boil water advisory is lifted. Hand washing should be done with alcohol-based hand sanitizer or antiseptic towelettes. If hands are visibly soiled, bottled water and soap should be used. Tap water should not be used to dilute products unless it has been brought to a rolling boil for greater than 1 minute and cooled before use. When the boil water advisory is complete, flush and shock the lines before resuming use. After all that we have learned today, let's talk about putting it all together by creating our safe water policy or program. Please write policies and standard operating procedures that are based on manufacturer's recommendations for the dental chair water lines and use of the required products. The policy should always be based on current best practices and all government regulations. Be sure to include hand hygiene, proper PPE use, contact times for shock, disinfectant, and germicidal products. Of course, dental unit waterline treatment, testing, maintenance, and monitoring instructions, and use of sterile water with sterile devices for invasive treatments. Know how to purge the lines and clean and dry bottle reservoirs daily. Then make sure the policy includes education requirements for all responsible staff on shocking, testing, maintenance, and monitoring, PPE and signage usage, boil water advisories responses, and auditing staff practices regularly to ensure staff are competent and comply with effective protocols. In summary, dental unit waterline biofilm treatment and maintenance is essential for preventing patient and staff harm. There are 4 steps required to ensure safe dental water. They are treat, test, maintain, and monitor. It's important to create dental water policies and procedures guided by manufacturers, the CDC, and regulatory bodies. Most importantly, train all staff who perform dental unit waterline tasks and monitor them for competency and compliance. Here are my references. Are there any questions?
I think there's some questions in the chat. Oh, they put their hand down. Sorry. Oh, someone has their hand up. I can allow them to ask a question.
According to the law, we should keep our water, testing water, at less than 500. In some states, state may come in and ask you for your testing log and proof that you have been testing. It is best practice to do quarterly testing. Does that answer your question, Jessica? Thank you. I do believe that the presentation will be shared after the presentation, and there will also be a YouTube video that will be available on the Health Information portal for Philadelphia Department of Public Health. Thank you. Thank you all so much. Does anyone have any further questions? Let's see. Okay. Okay, great. I'm so glad you all could make it today, and I hope to see you again in the future. Take care. You can make sure to like my YouTube video.